So again, all the doubts will be at the end of class with summary. So the very first thing we're going to start with the basics. Okay. So P wave. This wave tells us about the atrial depolarization. PR interval will tell us about atrial ventricular conduction, which is from here till here, right? Then Q1 will tell us about septal deviation, whereas complete QRS complex will tell us about ventricular depolarization. And T1, okay. The T1 tells us about ventricular repolarization. Now QT is complete ventricular phase, okay. So it is what? It is ventricular depolarization plus repolarization. Clear everyone? Right? To complete QT phase is nothing but ventricular phase in which depolarization and repolarization both things are happening. Okay. Why I'm telling you this is कि in ECGs, if P is normal and just T is disturbed, which means it is ventricular problem. So atrial options will be ruled out. Okay, that's why it is important to know this thing. Now coming on to the basic one. Before starting it, let me tell you something. The very first problem we see is ki which lead do we have to see, right? Everyone has that thing in brain ki oh, should we watch the lead 1, lead 2, or lead 3? The best lead is lead 2. Why? Because it is a law which says that lead 2 is equal to lead 1 plus lead 3, and that law is Enthoven's law. So whenever in problem, the very first thing you have to see is lead 2. And but in the case of myocardial infarction, of course, there we will see all the lead. But if I'm telling general ECG, lead 2 is the one we will look at. Clear everyone? Now, the very first thing in basics, which I want you guys to know, the first things first is the very first thing you will see if the ECG, whenever ECG will come in front of you, there will be the three things you will see. The first thing you will see is it is regular or irregular. Now, how do we know if it is regular or irregular? Is we will see the R interval. We will see which interval? R interval from one R to another R. 1 R to another R. If RR interval is equal to second RR interval, it means this is irregular. Okay? But if RR interval is not equal to another RR, of course, if it is not, means irregular. First concept is clear, guys. ECG is coming in front of you. The very first thing you have to see is regular or irregular. Now let's find if this ECG is regular or irregular. Help me with this. Yes, even if you don't know how to find, just count the number of boxes. 1, 2, 3, 4, almost 5. 4.5, right? 1, 2, 3, 4, 4.5. 1, 2, 2.5. Batao, it is regular or irregular? Just count the number of boxes. This one is irregular. Clear everyone? Now let's go to this ECG. Now tell me the number of boxes. See, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Regular.
This one is regular. Clear everyone? The very first thing we have to see is it is regular or irregular, and we are done with that. Now the second thing which we have to see is it non-sinus or sinus? Sinus means presence of P wave, whereas non-sinus means that P wave is absent. Okay. Now let's see. Is it sinus or non-sinus? Batao everyone. PQRST. PQRST. P is present here. So this one is sinus. Okay. And same goes with this one too. This one is also sinus because P wave is present. If P wave is absent, we will see that ECG2. That is a non-sinus rhythm. Clear everyone? That is the second concept. And the last one and the most important one which will help in diagnosis is looking at the heart rate. Okay. Now heart rate, usually there is a formula which tells us that 300 divided by RR, something like that. There is a formula. Okay. But we will not use that formula in exam because we don't have that much time. We will see the number of boxes. If abhi hum karenge, we will do the number of boxes in upcoming slides. If the large square is less than 3, let's see here. If the large square is less than 3, then it will be tachycardia, right? And if it is more than 6, it will be brady. Now you must be thinking, oh, if it is more than 6, then it should be tachycardia. Agar large boxes, let's say PQRST, 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 it is less than 3. Jaldi ho rahi hai na? I mean, do you see the complexes coming soon? The large boxes are less than 3 means it is tachy. Now, if it is again more than 6, now tell me, is it tachy or brady? This one is brady. Understood, guys? So just remember, if it is less than 3 means complexes will be more towards each other. So that means it is a tachycardia. Whereas it is more than 6, then it is a bradycardia. Okay? So again, repeating three things. Whenever you see the ECG, the first thing first, see if it is regular regular or irregular, sinus or non-sinus, and the last one you have to see is heart. And your diagnosis will be in front of you. Clear? Give a quick thumbs up if it is clear. Okay? And one star point, if whenever you see if a patient is unstable and in the question they're asking you about the treatment will be always defibrillate. And what do I mean by unstable? Let's say he is unconscious, systolic blood pressure less than 80. Okay? Whenever you see such image, the answer will be direct defibrillate. कोई atropine नहीं देना, कोई amiodarone नहीं देना, no other drugs, directly defibrillate. ठीक है? If a patient is in shock, talk the patient. That's what the line is. ठीक है? Great. Now, a lot of you might be having an extra question that what is the difference between cardioversion versus defibrillation, right? Cardioversion and defibrillation is almost the same thing. We deliver the shock, but when do we deliver? That is the difference. In cardioversion, we will be delivering the shock at every hour. Like QRS में आता है ना, PQRST. With every hour, we will be delivering shock. With every hour, with every complex, the shock will be delivered. It will be like systematic shock. Okay? Whereas in case of defibrillator, when did I tell you have to use defibrillator? When the patient is in shock and he's not responsive, right? So it means just deliver the shock anytime, irrespective of the complex. Just deliver the shock. That is the only difference between cardioversion and defibrillator. Okay? Clear, everyone? Okay, now we'll start the important things for our examination, which is ECGs, and you will answer me whenever ECG comes in front of you. Tell me the heart rate, tell me sinus, non-sinus, and the third thing you have to tell me is regularity. वो बता दूंगा last. Now tell me this ECG. Tell me the heart rate. It is regular, irregular. Is it sinus, non-sinus? What it is? Do you see P waves? P wave is absent here. We can't see P wave, right? P wave is absent means this is non-sinus. First concept clear. Second thing, is it regular or irregular? 1, 2, 3. 1, 2, 1, 2, 3. This is irregular, right? And the third thing, heart rate. Is it tachycardia or is it bradycardia? Of course, it looks like tachycardia. Okay. Now, it is a very important one which comes in our examination. If P wave is absent, okay, P wave is absent, it is irregularly irregular and tachycardia is there. What is the diagnosis here? Just P wave is absent, we make a diagnosis of atrial fibrillation. Everyone's clear? Is it clear, everyone? Okay. Now tell me one thing on JVP, which wave will be absent? If we see on JVP, which wave absent in the case of atrial fibrillation? It is A wave. Okay, guys? Clear, everyone? Now, atrial fibrillation, you got to diagnose it. Okay? See, P wave is absent, irregularly irregular, right? And third one was, it was in tachycardia. Now, tell me, how do we have to, treatment kya hoga? What is the treatment of atrial fibrillation? The treatment is we have to control the rate because it is too much around 300 to 600. So how do we control rate is we will use a beta blocker which is esmolol, but esmolol is contraindicated when? Esmolol is what? It is a beta blocker, right? And beta blockers are contraindicated in the case of
Asthma COPD.
right, it is contraindicated, so we will not use there. Therefore, the what do we use there is IV digoxin will be used. Clear? Now, this is the mnemonic you have to remember. In the case of, I'm just revising quick medications because a lot of you asked for it. So, the treatment for atrial fibrillation is RACE, means rate control, anticoagulation, cardioversion, which is chemical cardioversion, and electrical cardioversion, which we talked about. Right now, if I talk about anticoagulation, there is an important table which you want to, which you has to know is chart to vastu score. ठीक है, it is या पढ़ लेना. It is important one. Before starting anticoagulation, which we read this score. And whereas C starts for chemical cardioversion, and which drug do we use for chemical cardioversion is we use amiodarone, which is IV amiodarone. Clear, everyone? ठीक है, किसी को इसमें दिक्कत नहीं होगी because it is a easy one. Now moving on to the next ECG, just look at this Jiffy and then look at this one. It is a PYQ. Okay, guys, the next important ECG is that sawtooth pattern, which you know, everyone must know. It is a sawtooth pattern. What is the diagnosis here? If you see sawtooth pattern and the risk factor is COPD. If you see sawtooth pattern and COPD history, then the treatment will be the diagnosis will be atrial flutter. Okay, clear, everyone? Right. So let's talk about the treatment of atrial flutter now. If it is same as in the case of, it will be same as atrial fibrillation. Okay, guys, treatment will be same. Even for atrial fibrillation and for atrial flutter, it will be the same treatment. There is just one difference. Can anyone tell me what is the difference? Just one difference. It will be in the case of this one, which is इलेक्ट्रिकल कार्डियोवर्जन, ठीक है। इलेक्ट्रिकल कार्डियोवर्जन के केस में वी विल बी गिविंग लेस अमाउंट ऑफ शॉक विच इज जस्ट 25 to 50 joules, whereas atrial fibrillation में अराउंड 200 joules का जाता है शॉक। क्लियर एवरीवन? दीज टू वर द मोस्ट इंपॉर्टेंट ईसीजीज, ठीक है। नाउ वी विल बी moving on थोड़ा सा complex ECGs, ठीक है। Now tell me about this one. Again, the ECG comes in front of you and you tell me three things: irregular, irregular, sinus, non-sinus, and the heart rate. देखो, we are sure this is a tachycardia, right? This is a case of tachycardia. We know that, ठीक है। 1 2 3 1 2 3 1 2. Yep, this is irregular. And is it sinus or non-sinus? It is sinus, guys. P wave is present there. Okay. Now see, is P wave looking same in all in every complex? The P wave is same or the morphology of P wave is different? It is different, guys, right? Different morphology of P waves. Now tell me, P wave was denoting as what? P wave का क्या मतलब था? When we did the basics, P wave was telling us about atrial, right? Yep. Now you will remember the name by the concept itself. A was for P wave was for atrial depolarization. ठीक है? Why atrial depolarization? P was present. Now see the morphology. 1, 2, 3. There are different morphologies of P waves. Clear, right? Therefore, multifocal. Multifocal means multiple morphologies. Atrial means P wave and tachycardia is present that we have already diagnosed. Is it clear, everyone? समझ आ गया सबको? How you have to diagnose it?
एक बार फटाक से।
P wave was for atrial depolarization. Atrial depolarization was for P waves. Therefore, we wrote atrial here. Multifocal because there were different waves of P. कोई ऐसी थी, कोई ऐसी थी. Therefore, multifocal and tachycardia. Why? Because we already diagnosed it is less than 3. Okay. Now, what will be the hints given in the examination? The hints given will be it is irregular. Of course, we have diagnosed it. More than 3 P wave different morphology, guys. This is the key point. You have to remember that more than 3 P wave की morphology will be present in the question. And the very important again COPD history. ठीक है? Now, how will you treat this? चलो guys बताओ. If I told you this is an important point in medicine, but how do we treat it? We treat exactly the heart condition here, or we will treat the condition which is leading to this ECG. Of course, if it is because of COPD, we have to treat COPD first, and then we will move towards the other treatment, right? So the very first treatment we have to do is treat the COPD. Okay, guys, and in pharma classes we have already discussed the gold guidelines, okay, which you can go and revise again. Clear everyone till here? Okay. Yeah, I think everyone must know this one-liner, so I just added it here. Canon A wave is seen in ventricular tachycardia and complete heart block, whereas steep X and absent Y descent is seen in case of tamponade, and these they are talking about JVP waves. Okay, chalo. Let's talk about this one. Tell me again three things which you need to diagnose any ECG: regular, irregular, sinus, non-sinus, and the heart rate. Tell me. P wave is present, right? It is sinus. Is it regular? Yes, this is regular, but it looks like tachycardia, right? It is almost the 3 less than 3 thoda sa. It is tachy. Now tell me, sinus plus tachy gives what? It is sinus tachycardia. Clear everyone? Just three things again I'm repeating. If you know those three things, you will remember the ECG always. ठीक है? चलो, shit, ये वो होना भूल गया. चलो बताओ guys क्या diagnosis है इसका? What is the diagnosis here? First of all, again, is it regular, irregular? Is it sinus, non-sinus? Everyone must tell. Right. देखो guys, usually they will be always in this there will be narrow QRX. What do I mean by narrow QRX? I'll tell you in the next ECG. Narrow means, do you see this thing? It is not the normal one, right? It is very narrow. It is not the broad one, not the normal morphology of QRS complex. And we will see global ST depression. Global ST depression, let me show you in this ECG. Like, just see this. Do you see that? In myocardial infarction, we have Padre sign, right? It did ST elevation. But here it is global ST depression. And tell me one thing, P wave is present, absent, or is it hidden with T? Guys, here in this case, it is hidden with T, okay? It is not absent, but it is hidden with T, and here the diagnosis is PSVT. Okay, it is paroxysmal supraventricular tachycardia. Okay, and what do you say that? There will be a sign in the question, it will be written that there is palpitation, but that will resolve when? That resolves by oral water, by local water. Okay, समझ गए guys? Which is nothing but a vagal simulation. Clear everyone? If we are getting a patient getting better, his palpitations are getting better with vagal stimulations, then the answer will be PSVT. And how do we remember it? It is narrow complex. Like just remember the complex is narrow here, and there is global ST depression. ठीक है. Now what is the acute drug of acute, if there is acute PSVT, what is the drug of choice here? The drug of choice is adenosine, which is IV, and other treatment which we can use is like catheter ablation, verapamil can be used if there is we want to do prevention. Okay, and other treatment can be vagal maneuvers. Clear, everyone? We will come on this one. I will explain the difference between narrow complex and wide complex. Okay, as of now just remember this is PSVT. Okay, now tell about this one. I told you whenever you are you are in confusion, just see either the last read or the second. Now tell me one thing, what do you see here? Is it, first of all, tell me, is it tachycardia or bradycardia? Of course, it is tachycardia, right? It is tachycardia. Clear, everyone? This one is tachycardia. Now tell me, do you see this thing, guys? I mean, does it look normal to you? No. Now compare this one to this one. Which one is narrow QRS and which one is broad QRS? This one here is broad QRS. Did you understand the difference now, guys? अब आपको समझ आ गया narrow और broad में क्या difference है? How you have to identify is this is broad QRS. Now we have tachycardia, broad QRS. What is QRS for? I told you about QRS for what? It denotes us about ventricles, right? In the basic we did P, QRS. QRS for ventricle. Now if we see tachycardia and it is of QRS, it means ventricle. What is the diagnosis here? बताओ, it is ventricular
VT.
tachycardia. Clear, everyone? समझ आया सबको? Just remember the waves. By waves, you will be remembering the diagnosis of the patient. Okay. Now let's talk about the treatment here. How will you treat the patient, guys? If a patient is unstable, tell me, if a patient is unstable, is in shock, of course you will shock the patient. Okay, which is pulseless ventricular tachycardia. And if he is unstable, then also we will give defibrillator. But if the patient is stable, stable means BP more than 80, then what we will give? We'll give amiodarone. Clear, everyone? Okay. Chalo, we'll answer this now. A 20 years old guy diagnosed with depression with suicidal tendency. ECG scheduled next Monday. On next weekend, he consumed 20 tablets of amitriptyline, which is nothing but TCAs used in depression, right? And he was found unconscious by his mother and was rushed to ER. इसका PR 200 है, BP 160 है, and ECG was done. Which of the following is the best treatment? Tell me. Cardioversion, defib. Cardioversion, no. Defib, no. Why defib? Anyways, the patient is stable, right? It is above 80, so we will not use. And we know amitriptyline is TCA, and it is a diagnosis of TCA toxicity, right? If TCA toxicity, then the drug of choice is sodium bicarbonate. Clear, everyone? Okay, perfect. Chalo. Now we'll move on to the next question. बताओ ये वाला question क्या है? अभी we did here was broad QRS. But do you see the morphology here, guys? All QRS are looking एक जैसा. I mean, there is no much difference in any QRS. They all look similar. ठीक है? Now we are moving to a QRS complex where QRS looks different to each other, different from each other. ठीक है? Now tell me this. Here morphology is not same, right? The morphology of QRS is different. Of course, it is a problem of ventricles only, but the morphology is different. So what is the diagnosis here? It is polymorphic ventricular tachycardia. First of all, it is tachycardia. Why is it tachycardia? Because it is less than 3 big box, right? Of course, जब QRS होगा तो ventricles में ही होगी ना, atrium में नहीं आएगी problem. ठीक है? Now, if we talk about ventricular है, here QRS is what? Is it broad or narrow? And is it like same morphology or different morphology? It is variable morphology. Okay? If you remember by the name, you will be remembering the diagnosis. Therefore, the diagnosis here becomes polymorphic ventricular tachycardia. Clear, everyone? Abhi we will do the difference between polymorphic ventricular tachycardia and simple tachycardia. And drug of choice for polymorphic ventricular tachycardia is magnesium sulfate. Clear, everyone? Yeah, these are all one liners which you have to remember. Okay? Abhi let's do the difference because a lot of you will be, yo, kaise hua? I mean, how? Okay? Let's do the difference between ventricular tachycardia and polymorphic ventricular tachycardia. Let's see the first ECG now. In the first ECG, just see the amplitude of QRS, guys. The amplitude of QRS is almost the same. Can you appreciate it? I mean, just look at the amplitude of QRS. Okay? The amplitude of QRS means the height of QRS is almost same. Okay? Now let's देखते हैं नीचे वाला ECG. यहाँ पे देखो. Like one amplitude is more than the other, then there is a smaller amplitude wave, right? In short, if we have wide complex plus same morphology, it is ventricular tachycardia. Give a quick thumbs up अगर आप सबको समझ आ गया. Wide complex plus same morphology, same amplitude, it is ventricular tachycardia. Why ventricular? Of course, because there is a problem in QRS. If there is wide complex but different morphologies, wide complex, different morphologies, different amplitudes, the answer becomes polymorphic ventricular tachycardia. Clear? ठीक है, all done. इसमें कभी भी problem नहीं आएगी अभी. चलो, this is a one-liner Osborne wave is seen where it is also known as a J wave. It is seen in case of what? This is seen in the cases of hypothermia. Okay, quick question था ये. Right. चलो. Let's diagnose this ECG now. This ECG is famous by a wave. Of course, we will see the last wave, last one, or we will see the second one. Which one do you want me to repeat? This one? Okay, we will repeat in the end. Okay? Yes. Now see, let's see this one. Guys, यहाँ पे we have to appreciate one thing is कि in second and the last wave which is given, we will see something known as delta wave. ठीक है? अभी it's not clear, but let me draw here for you. It goes like this. Like, do you see that? वो ऐसे. This is the wave, and this is the wave is nothing but this is known as delta wave. Whenever we see delta wave, the very first thing which comes in our brain is what? It is WPW syndrome. आपको पता है? Have you, do you guys know about it or not? Okay, so guys, whenever you read about this WPW, it is nothing but it is because of accessory pathway. ठीक है? There is accessory pathway, and because of that accessory pathway, the patient is having palpitations. Like, you know, right? कि pacemaker of heart is a stenoid. एंड देन उसके बाद डेल्टा वेव इज नथिंग. आप जस्ट ये वाला देखो, वो ऐसे जा रही है. दिस इज डेल्टा वेव. यूजुअली इट शुड बी QRSE, राइट? दिस इज नॉर्मल वन, राइट? हाँ ना बोल दो भाई. ये नॉर्मल वन है. दिस इज नॉर्मल QRS. बट इफ यू सी दिस वन, दिस इज गोइंग लाइक दिस. वो ऐसे स्लैंट हो रही है. दैट इट इज नॉट नॉर्मल. दिस वन इज डेल्टा वेव. Whenever we see delta wave, we always first of all think about WPW syndrome only. And what is the reason of it? It is because of accessory pathway, and the patient will have palpitations, syncopal episode. ठीक है? Now delta wave के बारे में a quick difference, guys. We have delta waves, but one is seen on ECG and one is seen on EEGs. EEGs दिमाग में लगाते हैं. ECG, C cardio. ECG हार्ट पे लगाते हैं. ठीक है? और that's why on heart we will see on WPW syndrome delta wave will be present. Whereas if we talk about EEGs, it will be normally seen on NREM stage 3. ठीक है? It is from physiology integration. Great. ठीक है, guys. अब we got to know about WPW syndrome. Like, the patient is having palpitations, syncopal episodes. These are hint points in exam, and it is because of accessory pathway. If I ask you what is the treatment of choice, if it is accessory pathway, there is some accessory pathway, what will be the treatment of choice? What do you want? How do you want to treat the patient? Exactly. We will do radio frequency ablation. Why? Because there is accessory pathway, and we want that pathway to be harmed, right? We want that pathway to be like completely vanished. So we will do radio frequency ablation. But if I ask you what is the drug of choice, there is a difference between treatment of choice and drug of choice. If I talk about drug of choice, then it will be procainamide. ठीक है, guys? Clear? किसी को दिक्कत तो नहीं है? No doubt still here, right?
Dr. Saransh,
Yes.
sorry to interrupt. I guess some students are waiting in the waiting room. Please allow them. They're messaging me.
नहीं, it's open.
It's
अरे यार,
open?
उनको I think they have joined the old link. They are joining
Okay,
the
okay.
old link. So अभी
Okay,
the new link we have, I think,
okay,
should
okay,
share.
okay.
Yep.
I have shared it already.
Yeah, okay. ठीक है. Should we continue? Right? चलो. Guys, यहाँ तक was the most important ECGs. Like, those are very different and they have different morphologies too. But now we are going to start a very important topic, which is myocardial infarction. And I hope you know this is important. है ना? चलो, let's talk about it. अभी myocardial infarction is of two types. ठीक है? We have either STEMI and we have non-STEMI ones. इनके लिए रुक जाओ. किन के लिए? Dr. Kanika, do I need to wait for them?
Yeah, 1 minute, 1 minute.
ओके ओके. अब जैसे थोड़ा ही बचा हुआ है. ये आज के बाद तो रोना नहीं चाहिए तुम्हें ECGs को. इतना इजी हो गया.
Dr. Nishant, we can continue.
ओके, डन
They
डन.
will I said it again.
बताता हूँ दिपायन लास्ट में. That is too much of medicine information. ठीक है? चलो. Now we'll talk about the myocardial infarction. As we all know, myocardial infarction either can be STEMI or non-STEMI. And now in STEMI, we थोड़ा सा background दे रहा हूँ मैं. So in STEMI, we have fibrin clot, right? We have fibrin clots. The fibrin clot, whereas in non-STEMI, we have platelet clot. So therefore, what is contraindicate? Contraindicate in the case of non-STEMI. Can we use streptokinase here?
Coagulants.
No, we cannot use. So therefore, thrombolytics are contraindicated. Clear, everyone? Thrombolysis is contraindicated in a non-STEMI because it is a platelet clot, whereas in STEMI we have fibrin clot. Now we want to know the ECGs and the lead. Okay, we have V1, V2. Okay, V1, V2. ये थी ना यार, यहाँ पे देखो. We have 1, 2, 3, 1, 2, 3, V1, V2, V3, V4, V5, V6. Okay. Now we have to remember कि V1, V2 tells us about what? If it is V1, V2, it means this is on septum of heart. Okay? V1, V2 will be on septum. Whereas V3, V4 and V2, these three will be on anterior wall. Guys, समझ आ रहा है? This is थोड़ा learning वाला part, but just remember that V1, V2 means septum, V2, V3, V4 means anterior wall. And V5, V6 is what? Lateral. Just remember heart जो सबसे lateral में है, that is V5, V6. ठीक है? V5, V6 वो, बाकी सारे you can remember as anterior one. And this, we are talking anterior, we talked about interior, septal and lateral. क्या बचा? Inferior border, right? Inferior border will be 2, 3 and AVF. Inferior F, AVF 2 and clear, everyone. Okay, I hope this is pretty clear with you. Now let's talk about unka blood supply. V1, V2 septal, which will be septal LAD. V2, V3, V4 anterior wall, which is ADF, and V5, V6 will be LCA, and 2, 3 and AVF inferior wall will be right side. Clear, everyone? Okay. Now let's say if I'm telling all V1 to V6, all the leads may we have Padre sign. What is Padre sign, guys? Padre sign is convexity of S3 elevation, which is seen in myocardial infarction. अगर ऐसा है ना वो convex है, then it is Padre sign. If from V1 to V6 we have complete this, means सब में है, it is extensive myocardial infarction will be the diagnosis. ठीक है, चलो अभी some one-liners about myocardial infarction on the ECGs. What is the first investigation we will always do in the case of myocardial infarction? First बता रहा हूँ. First is ECG. When patient comes to you with chest pain radiating to left shoulder or left arm, the very first thing क्या करोगे? उसका वो myoglobin check करवाओगे या फिर you will do ECG? You will do ECG, right? What is the earliest finding on the myocardial infarction on the ECG, guys? It is hyperacute T waves. Nora, I'll come to that. It is hyperacute T wave. Whereas tall tented T wave, guys, चलो सब आंसर करो. Tall tented T waves का मेरी tent जैसी tall tented T wave,
Hyperkalemia.
it will be seen in hyperkalemia. ठीक है? Do not confuse tall tented T waves with hyperacute T waves. ठीक है? उसके बाद क्या होगा? After hyperacute T wave, there will be T wave inversion, and then there will be ST elevation, which helps us in diagnosing. And the last one will be deep Q wave. And guys, I think you must know that Q wave will always persist, right? If there is a patient is having an old case of myocardial infarction, the Q wave will be always present. Is it clear? ठीक है? चलो. Now we are doing a difference between hyperacute T wave and tall tented T waves. Right. Old MI में. You are right, Kamran. Hyperacute T wave and tall tented T wave. Let's do the difference. You already did. कि hyperacute T wave it is the first change in myocardial infarction, whereas tall tented T wave is seen in the case of hyperkalemia. Hyperacute means it is a very acute thing. Suddenly it is happening and it is very peak wala. ठीक है? Whereas if it is tall, it is very tall and it is like giving this one. Like you see that, guys, if you are having this morphology of ECG, this is nothing but hyperkalemia, and we have already discussed the treatment of hyperkalemia in pharma classes. If we want to reverse the ECG changes, like in this case, so the drug of choice will be calcium gluconate. Okay, but overall if they are asking for the increasing intracellular movement of potassium, then it is insulin. Okay, clear, everyone? Okay, now let's talk about S3's myocardial infarction versus acute pericarditis. Okay, if in ECGs we are seeing something like this is nothing but it is Padre sign, which I told you, and it is convex in nature. Okay, but if in the ECG we are seeing something like this, do you see the convexity here, guys? Concavity दिख रही है यहाँ पे. If it is concave, then it is nothing but pericarditis. It is concave, it is pericarditis. ठीक है, guys? Concave में it is pericarditis, whereas if it is convex, then it is myocardial infarction. Is it clear? And this is the summary which I have already told you. You guys have to remember it. This is very important for diagnosis. For myocardial infarction, this is important, and for general, all three things are important: regular, irregular, sinus, non-sinus, and the heart rate. ठीक है, चलो. Now we will diagnose the ECGs here. अब बताओ कि क्या है यहाँ का diagnosis. Let's talk. अभी V1 V2 देखते हैं. It is normal, right? No depression, no elevation, no elevation. थोड़ा सा है, ज्यादा significant नहीं है. V4 V5 not that much significant. Now let's see 2 3 and AVF. Do you see the Padre sign here, guys? I told you about the Padre sign. Padre sign is convexity, right? Do you see the convexity here? देख रहे हो यहाँ पे convexity 2 3 and AVF. I told you if it is 2 3 and F means inferior. So what is the diagnosis here? It is inferior wall myocardial infarction. And remember, guys, nitrates are contraindicated here. ठीक है, we will not use nitrates in the case of inferior wall myocardial infarction. ठीक है, is it clear, guys? चलो अब ये वाला बताओ. Tell me this ECG now. देखो V1 V2, do you see this? Convexity, convexity, V2 V3 V4, right? बताओ what is the answer here? It is giving which vibe? कौन सी vibe दे रहा है ये? It is giving anterior वाला है, right? It is anterior wall myocardial infarction. Is it clear, everyone? It cannot be inferior because AVF नहीं है. So it is just in anterior wall myocardial infarction. Is it clear? ठीक है, now we'll quickly talk about management of STEMI, which is जो अभी तक we saw two cases, right? One was for
तो वो
inferior wall.
एंटेरोसेप्टल क्यों नहीं होगा?
I mean, yes, we can call it anteroseptal too, but I think in V2, V3, and V4, you can see Patterson more prominent. That's why we called it just anterior. In in
Okay.
V1, it was not that much. If you see the baseline here, like see, इसको हम इतना significantly we cannot tell if it is significant. But if you see V2, V3, and V4, we have to see from the baseline, right? Like just see the baseline from here. ठीक है? Clear, guys? We always see the amplitude from the baseline. We will not directly see the shape and diagnose it, right? Chalo. About the management of STEMI now, a quick information. This is the mnemonic. कोई कुछ मोना बोलता है, कोई मोन बोलता है. So it is best mon. We'll give beta blockers, enoxaparin. S say we will use statins. And T, guys, T is for thrombolysis, and this is the most important step. Why? Because we have a proper door to needle time that is within 30 minutes. If patient comes to us, we have to start thrombolysis within 30 minutes of this myocardial infarction attack. Is it clear, guys? Okay. And M for morphine, oxygen, aspirin, and nitrates. Now, if I talk about non-STEMI, in the case of non-STEMI, what do we which step do we avoid? I told you in non-STEMI, the clot is of platelet closed, and it is not a like fibrin clot nahi hai. So do we use do we use fibrinolytics or not? No, we will not use fibrinolytics. This P wala step is contraindicated in non-STEMI. Clear, everyone? Now we are going to talk about the most confusing topic, which you all think is heart blocks. When it is, I'll come on that. Everything else we will use except thrombolytics, beta blockers, noxaparin, statins, morphine. Everything will be used except streptokinase wale drugs and thrombolytics will not be used. Okay. Now let's talk about heart blocks, which you all think is the most toughest one. And we are starting with the topic of bradyarrhythmia. Brady means what? More than 5 large squares on ECG. ठीक है, guys? अभी यहाँ पे देखते हैं. This is a normal ECG. ठीक है, just see this is a normal ECG, right? Can you appreciate PQRST, PQRST, QRS complex, right? ठीक है, चलो. We will start with this now, guys. It is type of heart blocks. Now just tell me one thing, कि what do you appreciate here? कि मतलब is it brady or tachy? First of all, tell me sinus, non-sinus, brady, tachy. What is it?
Ready.
Yes, it is bradycardia. It is bradycardia. This is sinus, right? T is present. Bradycardia. And third one was what? It was regular, non-regular, irregular, है ना? It is kind of regularity. ठीक है? Now, guys, just see one thing. Why I showed you normal was कि just see the PR interval here. Do you see the PR interval, guys? आपको दिख रहा है? I mean, you don't need to remember the time कितना होता है उसका, but it is pretty short. ठीक है? Now let's appreciate this ECG here. Just look at the PR interval. I mean, almost one big box. Do you see that? I mean, PR of almost one big box. It doesn't make any sense, है ना? So if there is no missed beat, कोई missed beat नहीं है. मतलब see, it is PQRST, PQRST, PQRS. There is no missed beat. It is going right. All the beats are coming. The only problem we are having is prolonged PR. If you see prolonged PR plus Brady, the diagnosis become, what is the diagnosis here? It is first degree P block. Clear, everyone? Is it clear? If there is just prolonged PR, means PR is just prolonged. plus bradycardia, no beast beat. It is first. Now let's talk about this one. Ab batao, which you guys get confused. Is it 1, is it 2, or is it 2:1? Okay? Let's talk about this. Now sab aram se sunna please. Then again you will ask me to repeat. Everyone must listen very carefully. Okay? Now let's see here. See, PQRST. PQRST. PQRST drop. What did you appreciate here? That PR interval is gradually increasing. है ना guys? PR is gradually increasing. PR, right? And then there was a drop. यहाँ पे there was a drop. So it was like increasing drop. It is nothing but Mobitz type 1. Okay? I will tell you how you have to remember it. Now let's see the second one. देखो. PQRST, 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 P, and then there is drop. Here, PR was increasing, and then drop. Here, the PR was constant and then drop. It is type 2. ठीक है अब of course आपको वहां पे इतना वो नहीं रहेगा. How you have to remember is देखो wherever we have a drop we will see one PR segment and उसका पीछे वाला PR segment. ठीक है wherever there is a drop see a PR in front of it and behind it. Is it equal guys? Here PR and here PR. Is it equal or not? This is not equal, right? बोल दो. PR before
No, it's not equal.
and after is not equal, so therefore this is 1. Okay, now let's see 2 wala. Here is a drop. See this one PR and then see this one. Guys, ये is P but इसका R नहीं है. इसको मत देख लेना. This is P wave. You don't have to see. This is P wala. This is PR, right? Now see drop के आगे and then we have something drop के पीछे. Is it equal or not?
Yes,
Yes,
it is equal.
this is equal. Now how you have to remember Mobitz type 2. इस 2 को ऐसे कर दो सामने. It is equal, right? इस 2 को लिटा दो. It is PR before is equal to PR after. So 2 wala will be equal. Just remember 2 wala will be equal. And that's it you will never forget. Whereas 1 is always unequal. Single banda na. So it is unequal. Right? Clear everyone? Now if you see here, it is 3 complexes and then 1 drop. Do you see that? 1, 2, 3 and block. है ना? There is something known as 2:1 block. What is happening here is after every conduction there is a drop. See PQRST drop. PQRST drop. Do you see that? If you see such picture that there is always a drop of QRS, why हमने 2 क्यों बोला? Can anyone tell me? Why did we call it 2:1? Anyone? Guys, it's
हर
image.
ड्रॉप के पहले 2 P दिख रहे हैं.
Exactly. हर drop के पहले we have 2 P's. Do you see that? P. It is 2:1 block. Clear everyone? If you even remember by the image of the ECG, you will be able to remember in exam. ठीक है? Done. चलो अब ये वाला बताओ. ये वाला ECG बताओ. T P Q R S T P Q R S T. Anything is happening anywhere. It is non-synchro. बहुत अजीब सी ECG चल रही है. Is it type 2 or type 3? Number of P does not match number of R. It is type 3. It is also known as Adams-Stock syndrome. ठीक है? Clear everyone? ठीक है? अभी treatment of all blocks is very simple कि first of all we have to again start with that is पूरा ABCD वाला airway देखो IV access flow, right? But last में we have to use transcutaneous spacing. If from pharma point of view, what is the drug of choice for bradycardia? Oh my god, what is the drug of choice for bradycardia, guys? It is atropine. If brady is there, there is decrease in heart rate, right? We have to increase the race. How we will increase the race? We will give the pacemaker. Okay? There is something known as Brugada syndrome. Okay? It is a problem in we will see that hints will be there is a family history of cardiac death in sibling, palpitation will be present, and on ECG we will see ST elevation in V1 to V3. And if you see that it looks like horse saddle, right? So you can call it a saddle pattern, or you can call it a cough pattern. Okay? If you see something like cough pattern, you just remember it is Brugada syndrome, nothing else. And from pathology point of view, this here where is the problem is SCN5A. Okay? And how do we treat here? We will treat by ICD, right? We have 3 types. In type 1, it is important. एक ही बार आया exam में, so you just need to know. In type 1, we have cough pattern, whereas type 2 will be starting of the settling, and type 3. Do you see this, guys? It is looking like 3, right? This is type 3 Brugada, whereas this one is nothing. इसमें इतना ज़्यादा 3 नहीं बन रहा. This type 2 and this one is cough pattern. Great everyone. चलो ये बताओ. What is this? Which test is this?
treadmill.
Stress
Yes,
test.
this test. It
Treadmill.
is a tread. It is yes. It is treadmill test. It is used for stable or unstable angina.
Stable.
Yes, it is used for unstable
Stable.
angina because unstable करेंगे वो उधर ही चला जाएगा, right? So drug of choice for chronic stable angina is what? It is beta blockers like metoprolol. And where is it contraindicated? Treadmill test is contraindicated in two places, which is बताओ एक unstable angina में and also in the case of recent MI. Is it clear, guys? ठीक है? And we use a score here, which is a Duke score. And Duke's criteria is where do we use Duke's criteria?
Infective endocarditis.
Right. We use it in the case of infective endocarditis. Okay. On ECG, you will see something like ST depression here. If how do we interpret it? If it is more than 1 mm na, we say that it is significant. If it is less than that, we tell it is non-significant. ठीक है इतना याद नहीं करना बस remember we have a Duke score. This is treadmill test and it is contraindicated in unstable angina. Why contraindicated? Because of course if he is unstable, if he is in too much of pain, आप इसको treadmill पे थोड़ी चढ़ा दोगे कि चढ़ जा है ना. So that's why it is contraindicated there. Now let's talk about extra ECGs. If you see here, we have E wave inversion and we have a prominent U wave. Usually U wave is normally seen too, but prominent नहीं होती. If you see such a prominent U wave, then what do we answer here? T wave inversion plus prominent U wave. And देखो यहाँ पे भी PR बढ़ा हुआ है. पहले
Hypokalemia.
right, it is hypokalemia, right guys? It is hypokalemia. We already did a place जहाँ पे PR was increasing plus bradycardia, no missed beat. बताओ क्या था? PR increased, bradycardia, no missed beat. It was type 1 heart failure. ठीक है चलो अभी most common cause of death in hypokalemia is what? It is diaphragmatic paralysis and most common arrhythmia if they ask is torsades de pointes. ठीक है चलो ये बताओ ये क्या है 4H and 4Ts. These are reversible or irreversible causes. These are reversible causes of cardiac arrest, guys. It is hypoxia, hypovolemia, hyperkalemia and hypothermia. Whereas 4Ts में क्या आता है thrombosis. Of course we start what thrombolysis. And then we have tamponade. Tamponade के लिए we do surgery. Remember guys, पता ना आपको कौन से ICS में करते हैं. And then we have toxins. Toxins means like poisoning होगी in the case of aspirin, something like that. And then tension pneumothorax. Tension pneumothorax which ICD do we insert guys? कौन से triangle of safety में करते हैं? Children में अलग होती है males वो उसमें in children we have sorry
किस संख्या को उसके
ये आप पढ़ोगे इसके बारे में कि in child which ICS and उसमें in adults which that's your homework. ठीक है चलो अब हम जल्दी से we are gonna revise summary. We are done with almost every ECG guys which is important. The most important one were heart blocks. After that was AFib, A flutter and normal ECGs were discussed too. ठीक है अभी let's let's do a quick summary कि हम how अगर एग्जाम में आ गया और we just have 1 minute how do we have to and you will answer me this time. ठीक है चलो if सबसे पहले when we are seeing a question in exam the very first thing we are gonna say is if a patient is stable. If a patient is not stable, then what do we directly do? Batao. Not stable means
Shock दे दो.
shock.
right. We will directly give shock means defib.
Refib.
ठीक है. Now if a patient is stable, let's say he is stable, yes. We did QRS, right? हम QRS देखेंगे. Now if QRS, we are seeing QRS, you have to tell me wide QRS किस we saw wide QRS, right? We saw wide QRS in two. One was in the case of monomorphic, and what was the diagnosis there? The diagnosis was ventricular tachycardia, जहाँ पे it was going like this, right? It was same amplitude, right? And another was polymorphic,
Polymorphic.
right? And in the case of polymorphic, it was like कुछ ऐसा सही था, right? The amplitudes were very different. Polymorphic ventricular tachycardia. What was the treatment of choice for polymorphic ventricular tachycardia? I told you. Polymorphic ventricular tachycardia, what did we give? We give magnesium sulfate, right, guys? And whereas for monomorphic ventricular tachycardia, we can just use antiarrhythmics like amiodarone. यहाँ तक clear है, guys? Now उसके बाद we saw something. कि QRS के बाद we saw कि it was narrow and which was the narrow QRS वाला we did बोल दो guys paroxysmal वाला नहीं किया था
Atrial fibrillation.
Yes.
we did narrow वाला right narrow के अंदर PSVT we did or not
PSVT.
right we did PSVT and in case of PSVT what did I tell you it was like this it was a PQRST ऐसे पास पास में चल रहा था, राइट? एंड व्हाट वाज द ड्रग ऑफ चॉइस ऑफ पीएसवीटी वाज एडिनोसिन, okay? Where the minimum dose I told was 6 and maximum was 12, ठीक है? And now if another thing, अब QRS is present but P is absent. This was what? This was
AFib.
AFib, right? And what was the treatment here was race, ठीक है? This was the summary. I hope किसी को कोई दिक्कत नहीं है इसके अंदर. And we are done with our ECGs and everything. Oof. Within 1 hour, if I'm not wrong. Yep. Is it clear, everyone?
Yes, sir. Any possible to get PDF?
Yeah, I will share. I will share the PDF.
Thank
soon.
you.
अभी किसी का कोई डाउट था? So, if you guys don't have any doubt, you can leave. And if someone is having doubt, can stay and ask their doubt. हाँ जी दीपायन बोलो.
भैया बहुत सारे डाउट्स हैं।
ओ भाई साहब, ठीक है.
मेरा एक ही है, क्लियर कर दो।
दी होल पीडीएफ भाई, आधी पीडीएफ थोड़ी भेजूंगा, पूरी पीडीएफ ही भेजूंगा ना, आधी भेज के मैं क्या करूंगा? और कौन है? हाँ ठीक है मृदुल, तुम बताओ पहले, फिर हम डाउट्स पे जाते हैं।
मुझे 2:1 and 3 वाले में जो हार्ट ब्लॉक होता है उसमें कंफ्यूजन होता है, तो
तब बोला था ध्यान से सुनो। अब
नहीं,
डॉक्टर
2:1 and 3 जो होता है, जो थर्ड वाला जो उल्टा सीधा होता है।
डॉक्टर कनिका, आप ये शान को बोल देंगे कि वो रिकॉर्डिंग बंद कर दे।
मैं बोलती हूँ।
क्या नाम? हाँ, ये 2 और 3 में कैसी दिक्कत हो सकती है तुम्हें मृदुल?
2:1 में and 3 में
तुमने तो आंसर दिया था कि उसमें 2 पीस आ रहे हैं, तो 2:1। हाँ, तो उसमें ब्लॉक, उसमें एक मिस्ड बीट हो रही है, यहाँ पे कोई मिस्ड बीट ही नहीं है, देखो सब चल रहा है, ठीक है?
कुछ तो डाउट था, रुको एक सेकंड।
ठीक है, हाँ जिद्दी पायन बोलो बा। अरे 1 मिनट रुक जाओ डॉक्टर प्लीज, मैं डाउट्स कर लूं, फिर मैं पीडीएफ भेज दूंगा
यार। इस तो 3 वाला जो है ना, 3 वाले में वो पी आ रही है ना, मतलब जो 2 पीक्स आ रही
पी
है।
नहीं है भाई वो।
हाँ, एक टी हो गई और एक पी हो गई, देखो ना एकदम नीचे
यार
वाले।
देखो यहाँ पे पी और आर, यहाँ की डेफिनेशन ये है, देखो प्लीज, कहाँ लिखी मैंने डेफिनेशन?
ये रहा
ये रहा यार, नंबर ऑफ पीज इज डज नॉट मैच द नंबर ऑफ आर्स, ये उसकी डेफिनेशन है। वेरस अगर आप ये वाला देखो, एवरीथिंग इज गोइंग प्रॉपर सिस्टमेटिक, वो सिर्फ ड्रॉप्स आ रहे हैं बीच में, ठीक है? यहाँ पे कुछ ऐसा ड्रॉप्स नहीं है, समझ रहे हो?
नहीं, उसमें भी तो पी और आर
ये लिख
मैच
पी,
नहीं हो रही।
ठीक है देख, पी क्यू आर एस टी पी, पी क्यू आर एस टी पी। हाँ आई मीन बट नंबर ऑफ पीस इज नॉट इक्वल टू, या भाई तुमने मेरे को भी कंफ्यूज कर दिया, तो अलग लैंग्वेज किया। नहीं ऐसे ये वाला, ये 2:1 नहीं है, पर ये 2:1 ब्लॉक नहीं है यार, उसकी मॉर्फोलॉजी अलग होती है भाई। देख इसकी, जस्ट सी यहाँ की मॉर्फोलॉजी ऑफ क्यूआरएस एंड सी यहाँ का मॉर्फोलॉजी ऑफ क्यूआरएस, एक बार जस्ट अप्रिशिएट करो उसको, देखो। आई मीन डू यू फाइंड दिस, ये वाला नॉर्मल लग रहा है या फिर ये वाला नॉर्मल लग रहा है? एक चीज बताओ बस।
देखो नॉर्मल तो ऊपर वाला ठीक है,
क्यूआरएस और यहाँ का जस्ट यहाँ का क्यूआरएस देखो यार, बेसिकली जब भी बहुत डिस्टॉर्टेड ईसीजीज होती है ना, व्हेन ईसीजीज आर टू मच ऑफ डिस्टॉर्टेड, देन वहां पे हम इसका नहीं, वी डोंट थिंक अबाउट क्यूआरएस, ये सेकंड डिग्री या फर्स्ट डिग्री वाला ब्लॉक, क्योंकि उसमें क्यूआरएस का मॉर्फोलॉजी विल बी मोस्टली द सेम, हमेशा सेम रहता है। बट इफ समथिंग इज लाइक दैट कि नंबर ऑफ पीस ज्यादा है, नंबर ऑफ आर्स कम है, या फिर नंबर ऑफ आर ज्यादा है, पी कम है, देन इट इज एडम स्टॉक सिंड्रोम व्हिच इज टाइप 3 हार्ट ब्लॉक, ठीक है?
एक और डाउट, क्या ये दोनों ऑप्शन वो लोग साथ में देंगे?
नो ये मुझे नहीं पता, ये एग्जामिनर से पूछा एनबीई से। चलो नेक्स्ट डाउट, दीपायन बोलो।
भैया पहले मेरे को ये बता दो, ये एडम्स ट्रस्ट वाला जो है, ये कंप्लीट हार्ट ब्लॉक है क्या?
हाँ इट इज कंप्लीट हार्ट ब्लॉक एंड टाइप 3।
ठीक है। और दूसरा चीज जो आपने डब्ल्यू पे बोला था, वो कौन सा वाला एक्सेसरी था? वो बंडल ऑफ केंट था कि बंडल ऑफ हीस था?
नहीं बंडल ऑफ केंट में होता है वो।
बंडल ऑफ केंट, तो बंडल ऑफ हीस में कौन सा था?
मैं तो मुझे पढ़ने दो, फिर मेरे को भी नहीं पता बंडल ऑफ हीस में कौन सा था। तुम मेरे से मेडिसिन मत पूछा करो आके, ईसीजी होती है, ईसीजी पूछा करो।
You're mentioning about.
He is asking which bundle will be blocked in the case of WPW syndrome. That's his question, doc.
That is bundle of Kent.
Yep, that's what. And he is asking कि which one will be in bundle of his.
ओके, तो ये आपको मैं बाद में पूछ लूंगा फिर।
हाँ मेरे को बता, मैं आपको बता दूंगा।
ठीक है भैया।
और
और बाकी ये एमआई वाले सेक्शन में ना, जो आपने राइट, सॉरी वो लेफ्ट साइड वाले जो बोल रहे थे ना कि एंटीरियर वाले, वो एक बार बता दो ना कि कौन से में देखते हैं, क्योंकि आई इंफीरियर वॉल एमआई मेरे को मतलब समझ में आ गया, बट वो जो एंटीरियर वाला था ना, सेप्टल वाला था, और जो एक्सटेंसिव वाला तो चलो सब में हो जाएगा आई गेस, V1 से V5 तक सब में। बट
एक मिनट, मैंने वो मिला मुझे मेरे नोट्स में, इफ देयर इज एक्सेसरी पाथवे इन अ जेम्स बंडल देन इट इज लॉन्ग एनॉन्ग लिवाइन सिंड्रोम आता है. इट इज सेम
अच्छा,
एज
हाँ हाँ हाँ,
WPS. दैट इज
ओके
नॉट
ओके
हिज, दैट इज जेम्स बंडल के अंदर होता है. एंड ऑफ कोर्स ट्रीटमेंट ऑफ चॉइस सेम ही रहता है, विच इज रेडियो फ्रिक्वेंसी एब्लेशन. ठीक है,
भैया.
समझ गए.
मतलब बंडल का कोई दिक्कत है तो उसमें रेडियो एब्लेशन ही करेंगे हम लोग, है ना?
अगर बंडल ऑफ केंट है देन इट इज WPW सिंड्रोम, एंड इफ इट इज
जी,
जेम्स वाला
लॉन्ग
इट इज
एनोन
दैट
वाला.
वन. ठीक है, क्लियर एवरीवन.
ओके ओके.
ठीक
और
है
एक और चीज आप वो बता दो मेरे को, जो ये MI वाला था.
यार, वो मैंने आपको समझाया था कि अगर V1 V2 की बात कर रहे हैं,
जी
इफ वी आर टॉकिंग अबाउट, पहले इंफीरियर वाला सबसे अलग है. इंफीरियर वाला याद कर लो. इट इज जस्ट 2 3 एंड AVF. आई टोल्ड यू AVF मींस inferior plus 2 and 3 will be inferior wall. ठीक है.
जी भैया.
Now if we talk about V1 V2 will be septum. It
जी
is septum. If
जी
V2 V3 V4 guys ऐसे याद कर सकते हैं. I think, I don't know, पता नहीं अभी कितना ये. अगर किसी का हार्ट है तो ऐसे नहीं होता, थोड़ा ओ गायब हो गया. हार्ट इज प्लेस लाइक दिस राइट, थोड़ा सा ऐसे टिल्टेड सा. तो हम 1 अगर यहाँ से लगाना शुरू करेंगे 1 and 2, तो 1 2 तो सेप्टम पे ही आएंगी ना, राइट. Then 3 4 will come on the anterior side. 5 and 6 will be laterally, right.
जी भैया.
है ना.
तो
तो ऐसे ऐसे याद कर लो कि अगर ऐसा हार्ट है तो अगर हम ECG से हम यहाँ से लगाना शुरू करते हैं ना, पता होगा आपको V1 कहाँ लगती है.
जी
सेकंड इंटरकोस्टल स्पेस ऑन द राइट साइड ऑफ द स्टर्नम. देन कम सेकंड वाला, सेकंड इंटरकोस्टल स्पेस टू द लेफ्ट साइड ऑफ द स्टर्नम, राइट. तो जब
जी
V1 और V2 लगाते हैं तो साइड से लगाना शुरू करेंगे ना, तो हम पहले
जी जी
सेप्टम पे लगाएंगे. फिर उसके बाद 3 4 हम इंटीरियर वॉल पे लगाएंगे. एंड लास्ट वाली बची 5 6 हम मिड एक्सिलेट लाइन पे लगाते हैं. तो दैट बिकम्स कौन सा वाला, लेटरल वॉल. ठीक है, समझ आ गया.
लेटरल वाला. जी भैया.
ठीक है.
और ये और एक और चीज इसी में, वो आर्टरीज कौन से होंगे वो आपने कराया नहीं, तो वो
नहीं
इम्पोर्टेंट है ना.
करवाया क्यों नहीं, मैंने ये लिखा तो है सारा, ये रहा.
आर्टरी. ओके ओके
मैंने
ओके,
मैंने
मैं ये
बोला कि
देख
अब
लूंगा.
खुद पढ़ लो ना.
ठीक 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 ठीक
क्योंकि
ठीक ठीक.
ठीक
नहीं,
है.
ये शायद मैं ओवरलुक कर गया होगा,
नहीं
सॉरी.
नहीं नहीं, मैंने ये देखो, मैंने स्टार भी लगाया था कि दिस इज
जी
इम्पोर्टेंट,
जी
यू
जी
हैव टू लर्न दिस. ठीक है.
जी भैया,
हाँ
जी भैया.
हाँ
और
जी.
लास्ट क्वेश्चन है.
हाँ बोलो.
लास्ट क्वेश्चन है मेरा, जो ये बाइजेमिनी और ट्राइजेमिनी वाला है, वो पढ़ने नहीं है ना.
अरे नहीं नहीं, पढ़ो पढ़ो, पढ़ना सब है भाई. पर मैंने यहाँ पे हाई लिंक कवर किया कि आपको एटलीस्ट डायग्नोस तो बनाना है. बिकॉज देखो, बाइजेमिनी ट्राइजेमिनी अगर वो ऑप्शंस में आएगा तो बाकी दो ऑप्शंस तो इन ECGs में से आएंगे ना कुछ तो. एंड यू
जी जी
माइट बी
जी.
नोइंग कि ये बाकी सारी ECGs कैसी दिखती हैं. तो
अच्छा
अगर
अच्छा.
इवन इफ यू नो अदर ECGs, अब यू डोंट नीड टू नो ऑल द 4 ऑप्शन.
ठीक
इवन
ठीक
इफ यू
ठीक.
आर नोइंग 3 ऑप्शंस, इट मींस यू आर एबल टू रूलिंग आउट दैट, है ना.
जी भैया. तो मतलब वो कैप्चर बीट वगैरह वो सारे मतलब बहुत बहुत कंफ्यूजिंग है वो,
सिर्फ आप
इसलिए मैं
देख लो
आपको बोल
उसको.
रहा था.
क्या कह रहे हो.
ये जो कैप्चर बीट वगैरह है ना, ये
हाँ,
बहुत कंफ्यूजिंग है.
सिर्फ एक रीड,
बाइजेमिनी ट्राइजेमिनी.
सिर्फ उसको एक रीड मारो, इतना कुछ वो नहीं है. अगर कुछ ज्यादा लगता है आपको, मैं आपको व्हाट्सएप पे रिकॉर्डिंग भेज दूंगा. ठीक है.
ठीक है
बाय
भैया,
जेमिनी एंड
ठीक है भैया.
ट्राई
थैंक यू सो मच भैया.
जेमिनी. हाँ जी, आयत बोलो. आयत.
मुझे ये पूछना था, हम कार्डियोवर्जन और डिफिब्रिलेशन कब यूज करेंगे? अगर क्वेश्चन में दोनों दिए हैं, लाइक कैसे हमें पता चलेगा? इनमें मैं कंफ्यूज हो जाती हूँ.
मैंने आपको स्टार्टिंग में उन दोनों का डिफरेंस बताया था. ठीक है.
आप एक बार प्लीज बताइए
हाँ,
फिर से.
डिफिब्रिलेशन हम तब, डिफिब्रिलेशन पहली बात अनसिंक्रोनाइज्ड होता है. ठीक है. इट इज नॉट सिंक्रोनाइज्ड. एंड व्हेनेवर द पेशेंट इज इन शॉक, उसका BP कम है, पेशेंट इज अनस्टेबल, वी विल नॉट डू कार्डियोवर्जन, वी विल डू डिफिब्रिलेशन. बेशक दोनों में हमें शॉक ही देना है, वी हैव टू गिव शॉक ओनली, बट कार्डियोवर्जन इज सिंक्रोनाइज्ड मोस्टली, राइट. इट इज सिंक्रोनाइज्ड विद द R wave. ठीक है. दैट्स व्हाई इन कार्डियोवर्जन हम इस केसेस में देते हैं, लाइक आई टोल्ड यू, ए फिब में, ए फ्लटर में आया था ना वहां पे. ए फ्लटर में RACE, from E was electrical cardioversion. ठीक है. Whereas defibrillation we can give any time irrespective of the R wave, and defibrillation is done in the patients with shock. ठीक है. Done.
ओके, थैंक यू.
Not at all. And the next.
डॉक एक बार वो चार्ट दिखा दीजिए ना वापस MI वाला. सिर्फ एक
अरे
बार
मैं
दिखा दीजिए.
नई PDF भेजने ही वाला हूँ वैसे ग्रुप में.
बस एक सेकंड.
हो
ओके,
गया.
थैंक यू डॉक. यस सर.
Not at all. ठीक है. अब किसी का डाउट तो नहीं, इसीलिए थोड़ा सा तो समझ आया होगा. I mean I think I made it bit easier for you guys to
जी भैया.
understand. ठीक है.
Doctor,
थैंक यू सो मच
positive
भैया.
or am I
Guess नूरा क्या कह रहे हो.
Doctor, in posterior wall MI, we have to check for the reciprocals.
हाँ yes, उसके लिए we have to use that V7 leads also. But अभी तक, to be honest, अभी तक they have never asked about that. The maximum they ask is about inferior wall MI only. ठीक है, अभी आज I didn't cover because I think we are very much near to examination, so it was not that much important to cover इतने ज़्यादा complex topic. ठीक है, that's why I didn't.
Okay, doctor. Doctor, one more question. This I have a confusion. How I cannot recognize between left bundle and right bundle branch block.
Branch block, okay. ठीक है, ये आपको आज I didn't cover the blocks here. LBB, RBB were not covered. I'll be sharing a picture and recording. Vanisha, right? That's from NT. Who's that? I'll be
Nora.
Noora, okay, yes, Noora. I'll be sharing that with you. ठीक है, group में. ठीक है, V7, V8, V9. ठीक है, and guys, all clear. ठीक है, फिर अब मैं ये भेज देता हूँ ग्रुप में and we are done with ECGs too. And good night, goodbye.